Hello, my name is Jasmine Johnson, and I'll be doing a wound dressing change. The first thing I would do is review my order and gather my necessary supplies. I would identify my patient by the two identifiers. I would explain the procedure to the patient and administer any analgesia and assess the patient's pain control. Then I'll perform hand hygiene and provide for privacy. I would place a wastebasket in my accessible location at the end of the bed, and I would position the patient in the best possible way. Then I'll perform hand hygiene again. At this point, I would apply clean gloves. I will drape the patient's blanket and gown in order to expose the area that I'm working on. And I would remove the old dressing, taking off the tape, and if it's hard to take off, I would moisten it with saline. Once I remove the old dressing, I will check for any drainage, the type, the amount, the odor, or the color, and then I will dispose of the old dressing in the appropriate container. At this point, I will take off my gloves and perform hand hygiene again, and then I will put on clean gloves. Then I will grab two cotton-tipped applicators. I will open them up, and I will assess the wound, looking for any tumbling or undermining, and then I will measure the depth without touching. The depth's about 3 centimeters, and I will discard, and then I'll measure the length, which is about 10 centimeters, and the width, which is about 3 centimeters, and then I will discard both. At this point, I will remove my gloves and provide hand hygiene again. Then I can open up my sterile field. I will open up all of my supplies away from me. And I will pour my normal saline solution into my gauze pads. And at this point, I can put on my sterile gloves. The first glove, I will touch only the inside. And my second glove, I will touch only the outside. And then I can discard my glove package. Next, with my wet gauze, I will take a piece, squeeze out the excess, and I will clean my wound from top to bottom. Discard. Do it again. Discard. And then I will dry the wound in the same way. Dry top to bottom, discard. Dry top to bottom, discard. And then with the wet gauze and a cotton-tipped applicator, I will loosely pack the wound without it overlapping on the outside. Once my wound is packed, I will discard the cotton applicator and I will apply dry gauze over the top of the wound. And then I am ready to put on my ABD pad. At this point, I can discard my sterile gloves, and my sterile field is done. I will take my tape and secure my new dressing across the top, the sides, in the bottom, and then I will note, date, put the time and my initials on the exterior of the dressing. Then I will remove my remaining supplies, cover my patient back up, lower their bed, give them their call light, assess their pain tolerance, and then I will perform hand hygiene and then document my procedure.